Hi, and welcome back to Danielle Klee SLP. My name's Danielle, and today we'll be speaking about oral habits and orofacial growth and development. Now, this refers to everything from thumb sucking to digit sucking to pacifier use to prolonged bottle use. It's all of these oral habits and how they impact the development of a kiddo's face. Now, this is oftentimes an emotional topic for parents because sucking is something that their baby or their child enjoys. An infant comes out of mom's womb ready to breathe, suck, and swallow. That's how they have, oftentimes one of their first feeding experiences with mom. It's often a time of bonding, and it's something that a child continues to use as a strategy early on in life for self-soothing. And that's because input to the roof of the mouth releases endorphins, and it feels great. But the question that I always encourage parents to really think about is what's developmentally appropriate and what's supporting the good oral and facial development of our kiddos. And it's important to look at milestones of oral and facial development and growth as we're thinking about this. So we're going to talk about some milestones today. We're going to talk about the impacts that prolonged sucking can have on a child's face and dentition, and we're going to talk about some different strategies for eliminating these oral habits. So first and foremost, speech language pathologists have different opinions. You'll meet some that say kiddos should never be bottle fed, they should never have a pacifier, and you'll meet others that argue that it can be for up to 2 or 3 years. I'm of the mindset where, I encourage breastfeeding, but if families need to bottle feed, I support them through that decision as well. If they've decided to bottle feed, though, I think it's important that we focus on helping the child develop along a timeline that's developmentally appropriate. So one of my favorite books is Nobody Ever Told Me or My Mother That. It's by Diane Bhar, and she is a speech language pathologist. She's a mentor. I look up to her greatly. And in her book, I think she does a great job of talking about how there have been some studies done to show that pacifier use can be beneficial in preventing SIDS, but she strongly encourages parents. She says that by 6 months, we should start weaning baby off of the pacifier and the thumb. And by 10 months, it should be completely eliminated. And I strongly agree. If you're lucky enough to have a kiddo who doesn't have that oral habit, that's great. But if your kiddo does, we should really start focusing on this early on. And the reason why is because of the way that the swallow's developing. So we'll take my mouth. Obviously, this isn't the mouth of an infant, but when an infant is born, tongue thrusting or an anterior protrusion of the tongue, the forward thrusting of the tongue is normal and typical, and it's actually healthy. If you were to look at a diagram of the airway and the facial development of a newborn infant, everything is really compacted. And so that anterior tongue thrusting and movement for feeding is helping keep the airway safe. And what's interesting though is that around 4 to 6 months, we see significant growth of the features of the airway, of the jaw and the mouth, and then we start to see a different tongue pattern evolving. We start to see lateral movement of the tongue, and we also start to see children able to reach the tip of the tongue up to the alveolar ridge, which is ultimately necessary for a healthy and correct swallow. Now, I want us to stay focused on oral habits without getting too much into the nitty-gritty of these developmental milestones. But what's important to recognize is that thumb sucking, pacifier use, prolonged bottle use, and sippy cups all reinforce this anterior thrusting of the tongue. Now, if you try to put your thumb in your mouth, you'll notice that your lower mandible retracts. Naturally, your tongue protrudes forward, and you'll notice with these kiddos, especially if it's something like a bottle or a bottle or a sippy cup, their tongue will be in a pushed forward down position when they're feeding and swallowing. And so this naturally reinforces an infantile swallowing pattern. In Diane's book, she does a great job of talking about how you can introduce cup drinking to little babies as early as 6 months of age. And that's something I oftentimes discuss with families and do here in the clinic. And I'm happy to produce another video on at a different time. But what's really important to recognize is that these early oral habits have a major impact on the growth and the development, not only of the teeth, but also the movement patterns of the tongue. I often show this to my little thumb sucking kiddos. This is an example of a kiddo who is a thumb sucker. You see that the lower mandible is significantly retracted in comparison to the maxilla, or the upper jaw, as opposed to, to this typical mouth, this typical bite. And that's because there's space right there, as you can see, to fit the tongue or the thumb right into the mouth. Research has shown that kiddos that are thumb suckers have a more high and a narrow palate, which would make sense, right? They're putting lots of force on that thumb, pushing it up multiple hours a day. They also have dental anomalies or abnormalities. They oftentimes have a higher incidence of an overbite, as dentists would call it. And we also see these concerns and issues with our kiddos who are bottle feeders. There's something called bottle mouth. And sometimes you'll see this anterior open bite with kiddos who are bottle feeders. Not only is there a spot for their tongue to fit, there's also a spot for the bottle to fit. And there have been studies done to show, prolonged bottle use is also a concern because it can increase cavities if you're feeding baby at night with a bottle. There are a lot of concerns when a child is still feeding primarily with this infantile sucking pattern. Similar to a bottle, a pacifier reinforces these infantile suck patterns, and there have been studies done to show that kiddos who are pacifier users have a higher incidence of otitis media, and we see similarly a lot of these dental anomalies. So I'm here to be a cheerleader for parents and for their kiddos. I know that these are emotional habits to break, but there are so many great tools and strategies that we use here in the clinic and that I teach families to eliminate these habits. And I have a protocol specifically for patients looking to eliminate these oral habits, where they come into the office. The first week of therapy, the first 10 days, I give them a call each day to check in and hear how they're doing. And it's based on positive reinforcement. It's based on behavior modification and really empowering the child with tools and strategies to eliminate these habits on their own. It also helps them identify when they feel the need to suck, coming up with other strategies and tools to meet their needs when they're feeling the urge. And I love it because it gives little kiddos as young as 3 a sense of empowerment. And for older adults, this can still really be an issue. There are individuals who are as old as 50, 60, some in their 20s who still are sucking their thumbs. And it's so important. I always say this is a non-judgmental space where I'm my patient's biggest advocate and biggest cheerleader to give them the tools and the strategies to eliminate these habits. Because especially when I'm working with an adult patient, if you're continuing to suck your thumb, it's going to be extremely, extremely challenging to remediate a myofunctional disorder. You think of how many times a day you do the exercises to retrain the muscles of the mouth and the tongue and the face, but then you throw that thumb in there and you're reinforcing all of these bad patterns. So you can go ahead, if you want to read more about some of the articles referenced, you can go to my website, which is daniellekleeslp.com. I've got a list of resources there. It's under the clinical topics tab, and you can also check out my Instagram account. It's daniellekleeslp, where I share tips, strategies, and info on recent research on there as well. But thanks so much for visiting wherever you are in your journey with your oral habit. I wish you the best. I just want to encourage you that the brain is neuroplastic, and it's amazing the changes that can be seen once a kiddo gets their tongue in the right place and they start swallowing correctly. And for my little kiddos who are thumb suckers, who are pacifier, chronic pacifier and bottle users, this is like the grassroots. This is where we start first and foremost before we even start targeting how they're swallowing, because we've got to get to the root. So glad that you guys could join me, and thanks again for visiting Danielle Klee SLP.